today?
I have a prescription here. I don't know if I should fill it. I was wondering if you can just kind of give me some more information about it.
Sure, no problem. My name is Brian Whiteside. I'm the pharmacist here. So you're coming here looking at Accutane.
Yes.
Okay, sure. So before we can get into this, I'm just going to make sure that nothing in your profile has changed.
Okay.
And then we can spend the great amount of time just on this.
Okay.
So could I get your name?
It's Sophie Samuelson.
Perfect. And could I just get your date of birth?
July 7th, 1992.
Perfect, thank you. What changes have there been to your medical profile since we've been here last?
I don't think there's been
Nothing?
any changes.
So no changes in allergies?
No.
No drug allergies, okay. And medical history, still just acne?
Yeah.
Okay. And non-prescription medications, here's vitamin B.
Yeah.
And then you're taking the Diane 35
Mm-hmm.
control and then Tactile.
Yeah.
Okay, perfect. So you said that you're a little bit concerned about taking Accutane, whether or not you could
Yeah.
take it.
So I've had acne for a few years now, and it's not really getting any better. It's pretty bad right now, and I'm getting married in 6 months, so I really want my acne to clear up by then.
Mm-hmm.
But my doctor told me there's some side effects with this medication, so I'm still not too sure if I want to get that filled.
Sure.
But I do want my acne to go away, so.
Okay, sure. So we'll definitely talk about this. I actually have a decision aid, which is
Okay.
here, and kind of helps us facility go through the process and kind of weigh out your values, and kind of whether or not this is the right medication for you or not.
Okay.
So just kind of, but first thing I'd like to just kind of understand is like your understanding of acne.
Okay.
So it seems like you've had it for a while, so you kind of know like what it is, and you've tried treating it. So what have you tried besides the Tactile?
I've tried all the over-the-counter medications, from the benzoyl peroxide ones to the salicylic acid ones. I've tried everything over the counter. I was on another birth control in the past as well,
Okay.
and that kind of cleared it a bit, but it got worse. So now I'm on that one. Yeah, I've pretty much tried everything.
Okay. And what have you heard about isotretinoin?
Oh,
Or Accutane, sorry, that's
okay.
the other name.
Well, the doctor told me that there's a lot of serious side effects, I guess. One could be very dry skin, and it could affect babies if I'm not careful, if I do get pregnant. And I think those are the only ones that I remember.
So yeah, those are valid concerns with this. And so kind of like looking at that, we're going to go through the process and kind of evaluate kind of like what you want to do. But before we get there, I'm just going to kind of go through some like conditions that with Accutane we want to be aware if you have or not.
Okay.
So pregnancy and like breastfeeding as a result of pregnancy. So you seemed a little kind of like as a side effect it might be.
Well, I am getting married in 6 months, but there's no plans of being pregnant. I'm still in school, so I am sexually active. So it's just something that's kind of been in the back of my head. If something does, you know.
And if you just want to kind of go through these conditions and see if there's any that kind of plague you at all. So high cholesterol, liver disease, you're taking any tetracyclines, minocycline, no. Kidney disease. Now, do you have high vitamin A intake, so do you take like supplements?
Not that I know of.
And do you have allergy to soybean oil parabens?
No.
Nope. Okay. So that's kind of good that we kind of know that there's no medical conditions that possibly affect. So now we're going to kind of go through the pros and cons
Okay.
taking Accutane. So what kind of involves with this? Are you going to be taking a pill with food every day for 12 to 16 weeks? So it's a good thing because it's kind of within your time frame before your wedding with getting rid of it. But the thing is, as you're a female, big concern is that you must not get pregnant with this.
Okay.
Because it can cause your baby to get mutation possibly, so deformities, and so that's a big thing. So you have to use 2 forms of birth control. So contraception, that usually involves using a condom, and then birth control pills. Another thing is because it can affect your liver, you want to kind of get blood tests every 4 to 6 weeks. Now compare this to no isotretinoin. What involves is kind of what you've already been doing, right, with the benzoyl peroxide, all that kind of stuff. Now the benefits of this is that it's a very successful medication. It can prevent scarring, it prevents a lot of damage, and a lot of times helps with anxiety because it does work so well. And like the benefits of taking no isotretinoin is kind of like, well, there are less side effects, as you've kind of commented on already. Now the risks are kind of the big thing, right? Especially this one's kind of a daunting medication where they're like, oh, risk. The thing with the risk is you have to evaluate like how bad is it and how important it is to me. So like one that like kind of, as I said, is it can cause birth defects. But the side effects, as you said, is dry skin. That's a common one. Dry mouth, dry eyes, and dry lips. You have the major ones, which I'm not sure if you've heard of. That's it, like depression, inflammatory bowel disease, pseudotumor cerebri, which is like swelling in the brain. So it's like it sound big names, but
Okay.
and then two kind of skin conditions right here that will result they're fairly serious. But again, these are very rare. So to kind of give you an indication of like this is like with isotretinoin how effective it is. If say 100 people take it, 85 with the first bout will essentially have their acne cured, where they won't have to get another medication. So it is a very successful medication, as opposed to if people just didn't use the medication, it'd only be 6. Now you're concerned about dry skin, which you mentioned, right? And kind of you took benzoyl peroxide as well. So you kind of have like a, kind of like dry skin from benzoyl peroxide. So about 10 people out of 90 will get dry skin from benzoyl peroxide, as opposed to Accutane, which will be about 22. So it will cause dry skin. The biggest one is dry lips. But what you can do is just moisturize your skin, moisturize your lips. So that side effect can be a little bit mitigated.
Can those side effects go away after a while, or
they're kind of there the whole time. So it's kind of like you have to kind of like root through it.
Okay.
And so yeah, so they won't necessarily go away, but you can help mitigate the symptoms by using lip chap, by moisturizing your face. Now the other thing is kind of a serious conditions like IBD and depression like that. And they've done a lot of studies, and it's kind of a conflict of whether or not Accutane actually causes it. And like with this one, it's kind of like if you take Accutane, 125 will develop IBD, so inflammatory bowel disease. That's when your digestion is kind of also constipation, diarrhea, kind of bad. But then if you compare people who don't, it's 107 out of 10,000. So it's kind of like
kind of the same almost.
Yeah. So this is like depression. This is like IBD. So it's kind of happens with a few. Now I kind of want to go through and assess your values and like how important this is, how important that is. So here, you can use my pen if you like.
Sure.
And just kind of go through the booklet, and we're going to go question and question. So 5 is very important, 1's not important. So how important is it for you to not have long-term scarring?
Very important. Yeah.
To have acne-free skin?
Very important.
Now, to not be affected with dry lips, dry skin. This was that side effect you're concerned with.
I guess it's kind of in the middle.
To avoid developing temporary depression, because this is a side effect that you can get with Accutane, supposedly, though the research is kind of conflicting on this.
It's not that important to me, so it's kind of in the middle.
And as you are a female, it's to become pregnant within the next year.
Probably not, so it's not that important.
Okay, no problem. So now that we've kind of assessed like your, what you kind of value most, so at this current state, are you willing to take isotretinoin decline, or are you still unsure?
I'm not too sure. I think I might just go home and talk to my fiance about it first. So, yeah.
Sure, that's definitely a good idea, and like take all the time you need, and I'll be right here. So if you have any more questions, you can come and ask me about that.
Okay.
The other thing is just kind of we're going to go through some questions just to see how well I kind of like taught you, and just kind of the understanding kind of things right here.
A quiz.
Yeah, so kind of a quiz, like,
Okay.
for fun though. So which option has a high success? So you have isotretinoin, no isotretinoin, both of them, or you don't know.
This one?
Yeah. Which one has the lowest success? The severe acne.
Probably this.
Correct. Which can cause dry lips?
Both? Well, this one probably more.
Yeah, so like it's about 97% of people will get dry lips taking isotretinoin, so it's a very common side effect. Now, which option may lead to depression?
It's kind of both. A
So,
little
yeah.
bit of both, but then there's a slight risk. So
Yeah, so like this one's kind of a tricky one because again, studies differ, and a lot of times what you hear is some people say yes it will, it won't. So that's a very tricky one. So there are some evidence suggesting that isotretinoin does, just kind of on like 1 to 2 people here and there, like more than 1 to 2, but just cases here and there.
Yeah.
So that one is really tricky. So it's actually isotretinoin, no isotretinoin. There's not really any like link, like there is links to depression in the sense that you can become anxious.
Okay.
So that's a good one.
Minute left.
Perfect. So these are kind of just things. So we've kind of go over in the pros and cons, right? And so you know which ones kind of matter to you. So for you right now, it's getting rid of your acne before you're well.
Yeah.
Right? So on a scale of 1 to 10, where are you kind of sitting with taking Accutane? What do you say?
Probably around 7 or 8.
7 or 8? Okay.
Yeah.
Sure. And you said you want to speak with your husband, which is perfectly fine. So feel free to speak with him, and if you have any more concerns, just phone me here at the pharmacy.
Okay.
I'll be here, and hopefully this kind of helps you kind of understand the pros and cons. So.
Okay. Would I be able to take this home actually, just to show him?
Yeah, sure,
And just
definitely.
go
And
over it with
once
him?
again, you can, if you both want to come in and kind of talk with me as well about it,
Okay.
feel free to do so.
Sounds good.
All right, thank you very much.
Okay. Thank you.
All right. So how did you feel about it?
Okay. I know.
Just okay.
Just okay.
Yeah. It's kind of, I'm trying to like go through it in my mind right now. I kind of got into like a trend and then it's not. But I want to like make sure I kind of hit all the points of the lab, but at the same time I felt like it was like restricting a little bit because it's like, oh, I'd naturally go to like when she talked about dry skin, I'd probably flip to the dry skin page, go to that. But then it kind of feels counterintuitive to be like, oh, let's go back and go through the process because now I just disrupted the process of the shared decision making, being like, oh, like I'm skipped into the benefits, but we haven't even talked about like, oh, should you even be taking it? So that's what I kind of found hard because I know with the labs you were kind of talking about that, and I didn't know whether or not appropriate or not to.
Well, you made the right choice because you had to stick to shared decision making. So,
Yeah.
You know, if you went into more the dry skin, you wouldn't have had time to finish, right? So, yeah, that was perfect.
I think you actually did a good job, especially going through every single part of it and just kind of going through the pros and cons, what would happen if I took the Accutane versus if I didn't. And then you went over the risks and benefits, and you actually went over and discussed it and explained it to me, which I really liked. And also going over the little quiz at the end, which is really good. I think you were very thorough, and I know that even though you kind of jumped from like explaining dry skin and the therapies to help with dry skin, it kind of helps me think in my mind that, okay, well, even if I do get dry skin, there's things to help. So it's kind of pushing me towards taking the Accutane. And then you still went back to finishing up the process. So I thought that was, even though it was a little bit kind of sidetracked, it was still good.
Not too much of a
Not too much,
either,
yeah.
right? You could have went on for 5 minutes.
Yeah,
about
then
it.
that would be too much. So you used to say, oh, there's moisturizers and lip balm. I was like, oh, okay, so there are things that I can do. So, yeah, I think you did a good job.
Yeah, I think definitely engaged the patient very well. Good explanation. You went through all this and made sure she understood. Yeah, in terms of little nitpicky things, I guess. You could have asked her if she wanted to go through this. Instead of just saying, hey, go through this. But not too big of a concern. One thing too that they wanted you to make sure is to make comment about how individual preferences matter and that there's uncertainty in medicine. You kind of did, maybe a little bit indirectly, but you did say there's valid concerns, all these side effects and stuff, and then you kept stressing that it's her choice too throughout the thing. Other than that, you described all the medical terms and stuff like IBD. You went into what it is and cerebral edema thing or whatever it is.
At first I was like, what are you talking about?
You started saying it in lay terms kind of thing. The only one that I'd probably consider changing would be mutations.
Yeah.
Yeah, say just birth defects or something like that. But yeah, other than that, very well done. Don't really have too much else to say. Yeah, and one thing you did very well too is that it just happened to tailor this very well. The dry skin thing. It's exactly one of our concerns.
I liked how you did the colors too.
The colors were nice
too. That was
too.
pretty
Actually.
cool.
Red, yellow.
All right, you guys.
It was great, man. No concern. Yeah, honestly, I think you're being a bit hard on yourself.
Yeah.
I think like you went through it pretty thoroughly. You engaged her well. You got through it all, which is amazing, considering there's quite a bit of information. So you were obviously you were good at choosing what to talk about and what maybe to leave out. I'm not sure if you went through every single point on there, or if you summarized points on there. But whatever you did it well because you got everything done in time and you gave enough information. It's not like you were I didn't feel like you were rushing through it.
Yeah, if anything, that was my concern. Why are you so hard on yourself?
Yeah.
Is this turn?
Oh, yeah. No,